Okay, so now we have routes of administration. So what I like to do to remember each one of these is I actually like to draw pictures. So if it focuses, sorry about that. So an oral medication. So an oral medication means that the drug is given by mouth and swallowed. It's either done alone or with a glass of fluid. I've seen people do both. So with oral, I'm going to draw little lips, because I know this person can take it by mouth. It's easiest and it's the safest and it's the most economical. However, it can be a little bit frustrating on the digestive system, and also the absorption takes a little bit longer. And some medications can actually irritate your stomach. So those are the downfalls of the oral. So if you go to sublingual is the next one. I'm glad that I can draw a straight line. So I'll draw like the kiss lips. So it goes under the tongue. That is what sublingual is. So it means that you place it under the tongue where it dissolves in the patient's saliva, and then it is absorbed really quickly into the bloodstream. So compared to the oral route, it is quicker. So these are going to come in the form of tablets. They're given for a systemic effect. So nitroglycerin is a really good example. So nitroglycerin, what it does is it widens the blood vessels. So if you are having chest pain, it's because you have a blockage. And so what nitroglycerin would do is it would open the blood vessels from being so little to a lot bigger to allow blood flow. So then your heart is getting blood flow and it doesn't hurt so much. So that's why that is given underneath your tongue. So when you give it underneath the tongue, again, it dissolves a lot quicker than if you were to swallow it into your stomach and wait for it to go through the digestion process. Okay, buccal is next. So buccal is really similar to the sublingual, but it is placed in the mouth next to the cheek. So I did talk about this a little bit. Remember I talked about the fentanyl sucker last week? So I draw a little sucker because it has to be next to your cheeks. So when it's, when it's placed in your mouth next to the cheek, it's absorbed through the mucous membranes. So these can be in the form of tablets or in a sucker. They should not be swallowed because of their potency. And then no food or drink is permitted until after it's dissolved. So there is that one. I'm sure everybody is familiar with topical. Got a real close-up of my hand there. So topical is applying a drug directly to the skin or mucous membrane for a local effect. So nitroglycerin or estrogen can be applied as a disc or a patch, or there are other kinds that you can use that actually do a more systemic effect, like fentanyl. So with topical, I like to draw a little square and label it patch. But you can also use topical creams and liniments and lotions, ointments, liquids. They can be sprayed on, all these types of things. Anything that's topical that's going to go on the skin can be considered topical. So the thing about topical medications that can be a little bit scary is that they can actually, if I have one fentanyl patch on and it's only supposed to be on for 3 days, and I put another one on and I forget that that one's on, I can actually overdose myself. So that is the thing about topical patches that you have to watch for. So anytime you see a patient with a patch on, you have to ask them if they have another patch on anywhere and look for it, because there are some people who are very used to these drugs. They'll put another one on just like a day later because they feel like it will give them an extra boost, but it can actually be very dangerous to the respiratory system. So that's what topical can do for you. So topical medications can be also dropped into the eyes, ears, and nose, which is called instillation. And they can also be inserted to the vagina, urinary bladder, and rectum, which is called insertion. Or they can be rinsed, which is irrigation. So how do you remember these things? Well, instillation you can put into the eyeball or into the ear. Just ignore my awful drawings, but that's okay. Insertion. Okay, when you insert something, what are you doing? You're placing it inside. So that's why it would make sense that you can insert it into the vagina or urinary bladder or rectum. And then you have irrigation. So irrigation, what do you think about when you think about irrigation? I think about sprinklers. It's my long hose and my sprinkler. No water coming out. So that's the one that you can rinse into the ears and into the eyes. If any of you are laughing right now, I totally deserve it. Okay, so now we have rectal. So rectal medication is actually what we just talked about, a suppository. So I draw a little suppository for the bum. And it does have that pointy top to put it up in your bum, so then it's easier. But it is not only a suppository, it can be an enema. So this route is usually used for people who cannot take something orally, so you would bypass it and go rectally. So if a patient is vomiting or if a patient is unconscious, you can't exactly open their mouth and say, hey, take this. So a suppository would be the best way to do it. Then you have vaginally. And vaginally is actually a cream. I don't draw a picture for this one, just letting you know. So you can put a cream, you can put a foam, or a tablet up there, and it kind of acts like a rectal one would be, and obviously only girls can get this. Okay, so then we have inhaled drugs. So I draw a little tiny inhaler. It looks like a shoe, I know. But you would press down on this part and the air would come into the mouth through that way. The medication would go through your mouth that way. So inhaled medications, they're very quick to get into the lungs, and it's a very large surface area, the lungs are, so it does really well at absorbing the drugs. And yeah, sorry, I was gonna say something else and I decided not to. So with inhaled drugs, the only problem is it's really hard to regulate the dose of the medication. So inhaled is not like the best route, but if you have asthma or some sort of lung disease, it's gonna be the best way to do it. We've had patients come in with asthma and we'll start with inhaled and then we go to intravenous, like a one-time dose, and then we go to a continuous IV dose. So inhaled, as you can tell, is going to be the first way that we're going to take care of it, and if it doesn't improve, then we're going to go to the IV access, which brings us to parenteral. So parenteral administration is where you're going to actually inject the drugs. So that's a needle. I really am horrible at drawing, but so parenteral, as you can tell, it's going to be really quick. It's going to be systemic and it's going to go really fast into your system. So when people are in pain, then they would want an IV drug faster because it's faster. If their blood pressure is dropping, you can't say, here, take this dose of medication that's going to make your blood pressure come up. No, you have to actually give them an IV dose of that medication to bring it up. The only there are many disadvantages of this. So injection equipment and medications must be sterile and free from microorganisms. So because you're putting this right into your vein, so that can be kind of dangerous. Also, they can be painful and awkward for patients to give to themselves. So yeah, I can give a shot easy, but if you have a patient trying to give themselves a shot, just think about that. Are any of you squeamish? Have you ever tried to give yourself a shot? I have not given myself a shot, but I think it would be a little bit hard for those who are not familiar with the medical field. Also, it's not a cheap way to give medications. So that's the type of thing you need to worry for. IV medications, they need to go directly into a vein, so you do need access. But medications that are not supposed to be in the vein, how do you know if you're not in the vein? And you stick it in there. There are special ways that things need to be done, as you've learned in chapter 4. So those are things to keep in mind when it comes to medications giving parenterally. Okay, so parenterally is not just one injection, it can also be a continuous infusion. So an infusion is when, I'm just gonna write the word infusion under this. So infusion is something that is going to be continuously being given. So to give an example of this, I have patients in the ICU that are on a continuous medication drip and a sedation drip. And the reason why they're on those two things is because they've had open heart surgery and their chest is still open. So something to think about is they need to have the ability to be asleep and sedated properly so they don't move and puncture their heart or their lung with their ribs. So as you can tell, the continuous infusion is going to be very important. So those are the different ways that drugs can be given.